Hello, this is Dr. Jatav with Foot and Ankle Associates of Southern New Hampshire, and this is another Fast Foot Fact. This is our third video in a series looking at sports medicine injuries of the foot and the ankle. This last video is going to concentrate just on some preventative measures, things that we can do to try to help prevent foot and ankle sports injuries. So one of the easiest ones to do, which often is overlooked, is just warm up and stretching exercises. So prior to starting any sort of sports activity or any sort of exercise, you want to make sure that you're warming up properly, whether this is just a light aerobic exercise or just doing some stretching to improve your flexibility, getting your muscles warmed up, getting your joints warmed up, getting everything more mobile. Can help to reduce the risk of stress and strain on ligaments, muscles, tendons, which can help to reduce the risk of injury. We talk about the importance of proper footwear, proper shoe gear, shoes that are designed for the sport that you are participating in. You want to make sure that you're wearing a basketball style shoe for basketball and a good running shoe for a particular running event or style that you're doing. You just want to make sure that they also fit well, making sure that they're not too small or too narrow. And then sometimes people require additional support, whether that's an orthotic or an arch support. If you have a condition that does require a little bit of extra stability, we obviously want to make sure that those are in place as well. Strengthening exercises, strengthening the muscles. So strengthening muscles in your feet and your ankles and lower legs can definitely help to prevent injuries. Good strength can help to improve balance, can help to improve stability. Both of those things are obviously important in helping to prevent injury. Some of these include just working on calf strengthenings, ankle strengthening exercises. Those are two big ones that come with trying to help prevent injuries around both the foot and the ankle. We talk about overtraining. There are some athletes that are obviously very intense, and we do have to talk about ways that you can overdo it. Overtraining leads to muscle fatigue, can lead to muscle imbalances, and anytime you have fatigue or imbalance, then you're going to increase your risk of injury. So you just want to make sure that you're giving your body enough time to rest and recover between the training exercises that you're doing so that you're not overdoing it and increasing your susceptibility to an injury. And that leads us to also doing proper techniques. Whatever sport or activity that you're engaging in, you obviously want to make sure that you're using a technique that is proper. You want to reduce the stress on the muscles and the joints to ensure that you're not overworking them or working them in the way that they're not supposed to be used. Certainly, if you're ever unsure about proper technique, make sure that you reach out to somebody who does, either a coach or a trainer, where you can kind of figure out exactly the proper technique of ways to do things. And then lastly, listening to your body, paying attention to your body, letting pain or any discomfort be a sign that something you're doing is incorrect or you're overdoing it. You want to make sure that you're not allowing your body to get past that pain discomfort, because again, you're going to increase your susceptibility of injury. So if you are experiencing any pain or discomfort with whatever it is that you're doing, you need to stop, either figure out what you're doing, if you're doing it wrong, or rest until you recover or you feel better, and then get back into it, but maybe getting into it more slowly and allowing your body to adapt a little bit better. So great. So this was our third video in a series of sports medicine injuries for the foot and the ankle. I do appreciate you watching. We will have some more videos in the future. Thanks again.